at this government for sure since the beginning of the pandemic. Thanks very much, Clarissa Ward, our chief international correspondent, covering that story. And joining me now is Dr. Layla McCay. She's the director of international relations for the NHS Confederation. Thanks for being with us, Dr. McCay. If you can hear me.
I can. Hello.
Oh, great. Thank you for being with us. Let me ask you first about these care home figures, because they are staggering. The government is saying 12,526 deaths overall in care homes across the country. There was a Reuters analysis, though, that puts the number of excess deaths in care homes in the 8 weeks to May 1st at 20,000. So there is a real possibility here that the number of care home deaths is actually a lot higher than the official figure. What's your reaction to that?
I think it's very concerning. I think that in the beginning, as the COVID pandemic started to really hit home, everybody was focused very much on the acute hospital setting. And really, it's taken a bit longer to realise that the battleground right now is really moving to those care homes.
Yeah, but in the early days of the pandemic, the criticism is that some of these hospitals discharged elderly patients that may have had other issues that needed dealing with, or that may have been infected with the COVID virus without testing them, and they're the ones who then spread the illness to care homes. That it was essentially irresponsible to do this. Is this something you agree with?
It's really hard to know what the system was that has led to these care homes having these problems. And I think it's a bit early to really start pointing fingers. Really, what we're trying to do at the moment is focus on the problem, figure out how can we best support these care homes to reduce infection and keep both staff and patients safe. That's the top priority for everyone here at the moment.
Keir Starmer, is the leader of the opposition in this country, confronted the Prime Minister Boris Johnson about the early guidance given to care homes and their staff. I just want our viewers to listen to this exchange from Prime Minister's questions on Wednesday.
Mr. Speaker, in a speech on Sunday, the Prime Minister said that we need to rapidly reverse the awful epidemic in our care homes. But earlier this year, and until the 12th of March, the government's own official advice was, and I'm quoting from it, "It remains very unlikely that people receiving care in a care home will become infected." Yesterday's ONS figures showed that at least 40% of all deaths from COVID-19 were in care homes. Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
No, Mr. Speaker, and it wasn't true that the advice said that. And actually, we brought the lockdown in care homes ahead of the general lockdown.
So let me ask you, Dr. McCay, it's not about pointing fingers. It's about holding the people who made those decisions accountable. And in March, it was widely known that the most vulnerable people when it comes to COVID were the elderly. Were they not protected enough?
It's really hard to say. I think that we have this challenge that this is a new disease and everybody's been trying to figure out what to do. But what certainly is clear is that there needs to have been more focus on care homes. There needs to be increasing focus on care homes now. There needs to be more investment. We need to figure out how to solve this challenge. Certainly, we need to start that as soon as we possibly can. That is in progress. There has been increasing investment. But at the end of the day, for many, many years, in many countries, including the UK, care homes have been the Cinderella of the health and care systems. And really, this is the time that our eyes are now being focused on this critical area where it matters so much that we get it right, and thinking, how do we get this right? How do we support care homes now and in the future?
But what is the solution? What is the solution? It's coming a bit late, don't you think? I mean, after potentially 20,000 vulnerable elderly people have died of this, potentially, isn't it a bit late to start thinking now about how to come up with a strategy?
There has been a strategy all along, but it's been an evolving strategy. And essentially, this has to be something that has been thought about from day one. We've been increasing the focus on it in our country, but absolutely more focus is needed.
Mm-hmm. All right. Well, thank you so much for joining us, Dr. Layla McCay. We really appreciate your time. Thank you for joining us on CNN. All right. We are going to go to where? Where are we going? We're going to a break. All right. We are. Coronavirus cases are soaring in Russia. We'll talk about that, but there's a very low death toll. So low, some say it is impossible. A look at how those numbers are being reported next.